life with an autoimmune condition. This conversation is made possible thanks to our platinum sponsor, argenx, and moderating today's discussion is Ms. Shelley Gerson. She is the Associate Director of U.S. Patient Advocacy at argenx. Also, Ms. Shelley brings experience in rare disease advocacy, education, mental health. She is joined by Meriel Parker, a myositis caregiver and rare disease advocate, who will be sharing her perspective as part of this important conversation. So please welcome Ms. Shelley Gerson and Meriel Parker.
Good afternoon, good morning to everyone. I'm Shelley Gerson. Thank you for all being here today. Meriel, let's just start this conversation. Could you tell us a little bit about who you are and what you do every day?
Sure. Hi, everyone. My name is Meriel Parker. I serve on the board of directors of the Myositis Association, and I'm the president of Archer Development and the founder of Penn Foundation, which is an organization, a nonprofit designed to circulate durable medical equipment amongst patients that have inclusion body myositis. And that's what I do every day, which is actually live as the daughter of a former myositis warrior, as we call them in the myositis community. That was my father.
Yeah, Meriel and I discovered that we have a common experience in that we both had dads that had chronic illness and were caregivers. How many caregivers for someone who might be dealing with any condition out there? Can you raise your hands? It's quite a few of you. Well, Meriel, being a caregiver is a lot of things. Can you just start off with telling us a little bit about the beginning of the story? Because for so long, your dad was a caregiver for others, including you.
That's right, that's right. Well, I'll give you a little bit of background information about my father. He was a former Vietnam veteran, a Marine Corps veteran. He was a proud member of Omega Psi Phi. He was a civil rights attorney and criminal defense attorney, the first Black deputy city attorney in Pontiac, Michigan. He changed laws in Michigan around voters' equity and was chief counsel for the NAACP for over 40 years. So my dad was a formidable, strong man, entrepreneur. No dream was too big for him. And if you have an opportunity to Google him, you'll see some of the big dreams that he worked on. And one day, though I should say I'm an only child, and I have one daughter, and she is my parents' only grandchild. And that meant the world to my father. So one day when my daughter was 2, my daughter is 16 there, she's sitting on the front row, Alexandria, forgive me. My dad wanted to take her to the nature center in Bloomfield Hills, Michigan, where we lived, so that she could learn about how to make maple syrup. And this was a place that my father had taken me. Can everyone hear me okay? It sounds a little echoey. It's okay? Okay. Taken us to that location many, many times. And it's a beautiful, sloping, serene area, beautiful trees. We're walking on the pathway to go learn about maple syrup. And my father looks at me, and he has a pained look in his eyes. And I said, "Everything okay?" And so he says, "Oh, yeah, no problem. Let's keep going." So we're walking still to the location. And then he stops. And I said, "What's wrong, Dad?" He says, you go on without me." And I said, "What are you talking about? We're here to do this together, the three of us." And he said, "My legs are so tired, I just can't make it up the hill." And the hill was a fraction of what I've just stepped up on this stage. It was just a little gradual slope. And I looked at him and I said, "Oh, Lord." I thought in my mind, I didn't say it out loud because I didn't want him to be concerned, but I said, "We're in trouble," because nothing would grip my father, let alone a small sloping hill. And that began our journey. So at that point, my father thought that he had perhaps back problems. Getting older, maybe it was stiffness. So I worked in breast oncology and quality for a hospital at that time, and thank God had lots of connections. So we got him set up with a surgeon, a back specialist to talk with, and went through a litany of appointments. And he was diligent, and we asked the right questions, and we prompted for referrals to specialists and so forth. And then after about a year, the surgeon says, "Mr. Parker, I am a surgeon. It's what I do. And it's the next step. It's the only thing I have left in my toolbox. But I fear that if I do surgery on you, it's not going to make a change in your condition. And so what I'd like you to do is go to University of Michigan and talk with a specialist there and see if there's anything that they might be able to determine is going on. And then you come back and see me if there's nothing more that they can offer." So we went to University of Michigan, and after they assessed my father's symptoms, they ordered a biopsy, a core biopsy of the thigh muscle. And lo and behold, they diagnosed inclusion body myositis. So that was the beginning of understanding what this rare disease was.
And really, that is just the beginning. I do have a question. I've noticed in your story about the road to diagnosis that you had to take many different steps and ask a lot of questions. And it was a road of needing to be perseverance and resilience. What do you recommend to the crowd if they're in a place where they're seeking a diagnosis of something that they're struggling with right now? Any recommendations?
Having worked in healthcare, I have found and I've seen that, for lack of a better term, the squeaky wheel gets the grease. And so I recommend, and it's what I do in my own household, my own family, is to monitor my own daily life with all of my stats and how I'm feeling and what's occurring, so that when it's time to go to the doctor, I come with that list. And when you bring data to your appointment, it almost makes it as though it's something that the physician feels as though they must address. And then they see as well that you're taking it seriously and that you're monitoring exactly what's happening as well. So self-advocacy is really what it comes down to. And if there's something that you perceive in your own body, in your own life that feels different, has changed, then you have a responsibility to yourself and your family to bring that to your doctor. So, and that's what we did in my family. And I think what we'll probably get into it a little bit, but I hope to talk with you about the method that we caregived in my family, because it's a little bit unique, and I believe it's probably what many of us do in this room, because we wrap our arms around our loved ones and we're a unit, and that's what we did.
Yes, absolutely. The caregivers in any situation like this are really key to getting the best care, in my opinion, because when a person is not feeling well, they're trying to manage just living with the condition and the symptoms. It's very challenging to do the very things that what were described, asking a lot of questions, going to different doctors, and just being there and having a second set of ears to hear the information that's being shared. So, Meriel, when you finally got a diagnosis, what was next? Because myositis, inclusion body myositis, is pretty rare.
Exactly. My mother was a public health nurse of 30 years and had never heard of IBM. I worked in clinical research and healthcare administration, had never heard of IBM or inclusion body myositis. Certainly my father, as an attorney, had no knowledge of it as well. And what we found, unfortunately, was that many of the doctors that ultimately my father would see had maybe one patient or had heard of it, had never actually seen a patient who had IBM. So it made the trajectory very difficult. And through the course of the next decade, many steps in our journey, we had to forge our own way. We had to climb our own path, and that was fine. But ultimately, I'm grateful to say we found the Myositis Association, which is one of the premier organizations to support patients who have myositis. There are multiple diseases in the myositis spectrum. Inclusion body myositis is the most severe and the most debilitating, and the only one that has no cure or treatment currently. So even though we found resources, unfortunately for my father, often, there weren't the answers that we were hoping for, which was certainly a cure. So, but we worked together on that, and to the point about advocacy, we would go to all of his appointments together. Either my mom went with him or I did, and we would work as a team. We would ask questions, we would scribe the answers, we would, ask the questions that would let the clinician know we are paying attention. This is someone who's very important to us, and you will please respect us and take the time to explain to us what's happening and what the very best you can offer to us is. And that's what happened all along the way, even though, unfortunately, there were no offers of any treatment or cure.
That must have been so overwhelming to get this diagnosis of something you've never heard of before, and then we all go to the doctor to get an answer, to get a treatment, and the answer was we have nothing. How did that impact your dad, and how did that impact you as his daughter, especially given what kind of man he was his entire life?
My father, when he started to learn what the trajectory of inclusion body myositis is, my daughter and I were living here in North Carolina, and my parents were living still in Michigan. My father said to me, if I'm going to fight this, if you really want me to be there with you and to fight this, I need to live in the same house as you and my granddaughter. Because you all are my heir. And that will give me the strength and the joy to be able to live through whatever days I have. And so that was not even an issue. And we went to searching every weekend to find a house that would be ideal for multi-generational living. Also, as my dad's trajectory, he went to a cane and a rollator, and then to a wheelchair, and a motorized wheelchair rather. And so the four of us moved in together, and we worked as a unit. And that's all I can say about that. It was just from that point forward, whatever he needed as his physical strength declined, our physical strength increased. And to be honest, I was going to share that November is Caregiver Awareness Month, and nationally, and it's not unimportant for us to focus on the fact that if you're a caregiver, you have to take good care of yourself. I learned firsthand of the toll that the stress takes on you, but we did what we had to do to keep him with us as long as we could.
So the medicine was really his relationship with the most important people in his life, and you were able to step up to do that, as was your daughter and your mom. You became the medicine for him. You did mention the toll. Are you able to share a little bit more about what the toll was on you as a caregiver, and what are some specific things do you recommend to try to take care of yourself as a caregiver?
Well, I knew that I didn't want to have any regrets, and I understood what the trajectory of inclusion body myositis is, and typically it's not survivable. And I did not want to have any regrets. And so I was going to pour in every ounce of energy that I could into having every moment with my father, and I did. But the type of relationship that we had was even before the diagnosis. I did that, and he did that with me, and that was just what we had. So it was not a sacrifice. It wasn't difficult. It was just needed to be done. And so, but my father was a night owl, and just having been a litigator and working at night many years on cases and so forth, he would stay up at night. And so when I would come down to check on him and refill his water and place his tray where he needed it to be, our nighttime routine, then he was ready to start to talk and to plan business and to have our priorities set before us. And so I did that. And I was working full time, and I was a mom, a divorced mom, so 24/7 there. And so I went without sleep a lot. And I started to have muscle tremors on my own, and started to go to a specialist for diagnosis. And I was worried that maybe I was developing IBM as well, to be honest. And one doesn't ever know what the future might hold along those lines. But as we started to go through the assessment process, the doctor asked me, "How much sleep do you get?" And then when I told her the truth, and then she said, "Okay, we need to make some changes." And once I prioritized sleep and maybe getting a massage once a month and taking a walk and taking some time for myself to actually have a break, it was necessary for me to be the best caregiver that I could be for my father and for my daughter. I learned the lesson the hard way, an expensive way.
Yeah, it's very hard when you love your family member so much to let go for just a few minutes to take care of yourself. But if you don't do that, then that's going to impact your ability to care for your loved one. When we spoke earlier, Meriel, you talked about best practice, and one of those best practices was to take care of yourself. Are there other best practices that you would like to share with the audience as a caregiver of someone with IBM or any other rare or chronic illness?
Thank you for that opportunity. Yes, I think it's very important to utilize the resources that are available to us. In our situation, as my father gradually lost the ability to walk, the ability to stand up or to grip anything, to even sign his name, the ability to swallow safely without choking. As those things declined, we needed to find the resources to try to help to bridge the gap. So there are amazing pieces of equipment in existence, like sit-to-stand, Hoyer lifts, and things of that nature. And those are very important, not only to preserve the safety of the patient, but also for the safety of the caregiver. And if you don't utilize those things, over the course of time, that toll will be taken on the caregiver's body as well. And then you can't care for your loved one. Now you have two people who are in harm's way. So that would be one item, is really to try to do as much research as possible and communication with physical therapists, occupational therapists, with your doctors, to find out what types of pieces of equipment are available. One thing, though, that I think was also unique in our household, we're living with something very heavy. My loved one is, on a trajectory that he won't be able to come back from, and that's devastating. But somehow we maintained a level of levity and laughter in the household that, to be honest, when my father passed away, one of my prayers was, please God, help me to be able to refill my life with that laughter. I couldn't see how I could do it, because it was just what we did together. And it lifted him and it lifted us, and we found that we could just still have life. Life looks different when we can't just easily get on an airplane and go on a trip. And my father, to be honest, made great sacrifices to be able to maintain life with us, meaning we had opportunities to have a little day trip. It was too difficult to go on a vacation, but we'd have a little day trip. And I won't get into some of the graphic aspects of it, but he had to prepare to be able to leave the house for a duration of time. And so he made those sacrifices to be with us. That kind of commitment and pursuit of shared mission is just really important, I think, when you're dealing with a rare disease. You don't have to lose sight of the family you were. It just looks a little different, and you move forward with the grace of God.
Yes, that's an amazing message. You know, you talked about all of the resources and accessing the resources. There are two things that I'd like for you to highlight a little bit more. And one is about this program that is sometimes offered, which is called palliative care. Many people, when they hear palliative care, sometimes it's paired with the word hospice, which scares people. Can you just really very quickly myth bust what palliative care is?
Sure. Yes, this makes me smile a little bit because I think back to when my father was first brought with the resources of Duke Home Healthcare. Duke Home Healthcare is also called Duke Home Healthcare and Hospice. When my father heard that, he was not yet in a wheelchair even. He was using a rollator. And so the thought of hospice being involved anywhere in his care at that time, he just could not compute that and did not want that. So the problem is that the home health aide, the home health nurse, the speech therapist, the physical therapist, the occupational therapist all came with that unit. So we needed that. So we had to have a conversation in the family that we need to kind of bypass, the hospice term, and let's get to those other components, which were so vital. And to be honest, as the trajectory of the disease took hold, I don't know, I'm sure that my father would not have lived as long as he did without primarily first the blessings from above. Second, our family structure, but third, the caregivers literally coming into our home and supporting us because when you have an autoimmune disease, you're immune compromised. We went through the pandemic with this situation. Let me just add, my daughter didn't go to school for 2 years. She stayed home doing telestudies so that we could make sure that we didn't expose my father during the pandemic. We knew that he could not survive an exposure. So just things of that nature. The fact that we didn't have to take him outside to go to the doctor. We could use telemedicine. We could have the nurse to come into the home. That was a blessing for sure.
It was a sacrifice for you. But any chronic illness, autoimmune or otherwise, it impacts the entire family, and that has to be remembered. I know we need to take time for questions. One last thing I know you wanted to talk about, which is the value of patient advocacy organizations specific to conditions. You mentioned that you're very involved. Can you just really quickly summarize what a patient advocacy organization does?
Yes.
And why it would be important to consider that? And then what does the myositis organization do for the community?
Yes, thank you for that question. It is so important to not isolate when you have a diagnosis of any type. Even if you don't have a diagnosis, it's important to not isolate. We're supposed to be here to be in community like we all are today. And but especially when you have a diagnosis of a rare disease, you feel as though you're the only person in the world dealing with this. You don't know anyone else who has that. No one else even knows what it is. So organizations like the Myositis Association are so vital. In fact, we had our annual global patient conference in September in Dallas. The next one will be next fall in St. Louis, Missouri. And these are opportunities once a year for patients, families, caregivers, researchers, providers, to pharmaceutical companies, vendors to come together and support this community. It is just honestly life-changing for so many who have the disease. My father was never comfortable enough to be able to travel because by the time we learned about the Myositis Association, he was struggling very much with mobility. And but we participated online with many of the resources that the Myositis Association offered. And it's free to join. There is no cost to participate and to learn and have support. There are support groups in each state, in cities in different states, and you can join those and participate remotely. And just a number of resources. There's a medical advisory board that each and every day is working to spur research, especially for patients who have inclusion by myositis, so that we will have a day one day where there is a cure and at least a treatment. But our dream is that there will be one day a world without myositis at all. So I welcome each of you to go to myositis.org and look at the resources. Even if you don't think it's relevant right now, you might know someone who could benefit from some of those resources. And we never know what's in our trajectory in the future. So it's just good information to have. And we appreciate your support as well.
That's great. And many conditions have these organizations, and that should be your first thing to do after you get your diagnosis and talk to your doctor, is to look for one of these organizations for whatever it is you have. The other reason it's really important to do that is that's where pharmaceutical companies connect with the community of people living with the conditions. And we also need to bring your stories and your voice into the planning of research, and we can't do it without you. So we are all part of these organizations, and please reach out. Meriel brought some materials that will be at the argenx table, which is just outside this door. Please stop by, and Meriel, you'll be there. So she will be able to talk to you personally if you'd like to. But right now, we have a few more minutes. We can take a couple of questions. Are there any questions?
Thank you for the information. This was a new type cancer disease. I've never heard of it before. But my question is, when you're facing these malignant cancers, what was the conversation when you know the inevitable? How did your family approach that particular conversation at the end, or when you were when he was diagnosed?
My father was an attorney, so we always prepared with wills and power of attorney and so forth anyway. But I think in our daily lives, we operated around the fact that we knew that there hadn't yet been anyone who survived that disease. But God is good. And so we just never know how long we have. And so we just operated to continue every day that we have to the best of our abilities, and we just moved on. I was with my father at that last moment, and I guess maybe I won't go down that road, but it's I'm grateful that I was there. Yeah. Mm-hmm.
I think we have one more question. Oh, right here.
I don't have a question. I just wanted to say thank you. I appreciate you being so vulnerable and you being here. I know it must be difficult for you to talk about it, but I love how even now you're still involved in it and you're helping so many other people, and you're helping people that don't have that particular condition but have other conditions. So thank you.
Thank you so
Yes,
much.
thank you for saying that. That's very true. Very, very true.
I appreciate
Yes,
that.
thank you everybody for being here.